Hi, welcome everybody. This is the panel session for Clean Air Day. And we're delighted to be joined by our esteemed panel and Karen Buck MP to chair the session.
Okay, good morning everybody. It's very good to have such an esteemed panel and members of the audience here for this 7th Clean Air Day and a really important focus here on the health issues relating to air pollution, particularly the partnership with Alzheimer's and some of the important scientific work that's going on to look at issues like mental health, dementia, and other conditions. We already know the top line science in terms of clean air and the number of deaths that are associated with breathing poor air, 36,000 in the UK alone, and it's a highly topical, in a sad way, of course, meeting today, because we saw the terrible images from New York only last week arising from wildfires. Not a particular problem in London, but nonetheless an important reminder of all the different ways, the different factors that can contribute to air pollution. And only this week, the London Ambulance Service has been issuing high-level warnings about the pressure on accident and emergencies arising from respiratory and related issues because of the poor air that's often accompanies weather of this kind. So it could not be more important that we pull together this scientific evidence. This is an all-party group. I'm the vice chair of it. I'm pleased to step into this. It is, it's not a party political event, but I will just make one small p political. Well, it's sort of a bit of both, which is the importance of the scientific evidence to the discussion that we're having around the ULEZ, and that is as one particular policy, and there will be others to help us tackle air pollution. And we need to be very aware, I'm sure everyone here today is very aware of the fact that these facts are not contested, and even though the clinical and scientific evidence should stand uncontested, and the debate could be about the policy remedies, it is not uncontested, and that is, I think, a challenge for everybody as to how we're going to take that debate forward. So thanks to Global Action Plan, thanks to Alzheimer's UK for organising today's meeting and bringing everybody together. And I'm going to move straight on to our first speaker, Professor Frank Kelly, an esteemed environmental public health expert and researcher, holds the inaugural Humphrey Britcock Chair in Community Health, Babcock Chair in Community Health and Policy at Imperial. Imperial, of course, a very leading organiser institution in this field, published over 380 peer-reviewed papers and confidence papers. Professor Kelly is going to present an overview of the excellent report from the Committee on the Medical Effects of Air Pollution, which he previously chaired. And this draws from the wealth of scientific evidence to conclude that air pollution does in fact impact on our brain health. So over to you, Gavin.
Thank you very much, Karen. And good morning, everyone. Welcome to Clean Air Day. I want to start with just some facts, just to bring you all up to speed to the basis of why we're talking about this today. So you can see from the slide, 1 in 5 people over the age of 65 in the UK have mild cognitive impairment. But importantly, of these, up to 20% of them will go on to develop full-blown dementia. And there's nearly 1 million people now in the UK who are registered with this terrible condition. And as a result of this, then, of course, it's having a big demand upon our National Health Service resources. So dementia represents up to 25% of NHS acute beds are occupied by people with dementia. And there's been a big increase in emergency hospital admissions over the last 5 years. So this is something which is increasing year by year, day by day, and it's just a terrible condition. It ruins people's lives and it stresses out the families where there is a dementia sufferer. So it's really something which we need to understand much better and therefore come up with A, treatments, and B, methods of prevention. So I'm going to talk about possible methods of prevention this morning. And if I can go to the next slide, please, Laura. I'm going to tell you about a report which the committee of the Committee on the Effects of Air Pollutants published last year. It took us a couple of years to go through all the evidence, and you can see here the title was Cognitive Decline, Dementia and Air Pollution. So in this report, we reviewed up to 68 studies, which basically are all relatively recent, published only in the last 7 years, because it's only in the these latter times that we've been thinking that air pollution can have impacts way beyond the lung. We've known about effects on the heart and some other organs maybe for a decade now, but who would have thought that actually air pollution can have direct effects on the brain? But it seems as if that is possible. So let's go through, let's just look at some of the evidence. Next slide, please. So we found 68 human studies which was examining the possible link between air pollution and basically effects on mental ability and subsequently dementia. And after reviewing those 68 studies, the committee felt that there was overwhelming evidence to say that we think it's very likely that air pollution contributes to both the decline in mental ability with age and the development occurrence of dementia in older people. So it was pretty straightforward, and that we agreed that this was a reason that people developed dementia. It wasn't the only reason, but it certainly was one of the contributing factors. So therefore, clearly, if we can do something about improving air quality, then this should reduce the risk of people developing dementia. Now, I'm going to take you through just a couple of the studies that were in this report. This first one we did with colleagues at St. George's Hospital in London. And what we did was we recruited 75 GP surgeries across Greater London. They were covering a population of just over 311,000 individuals between the ages of 50 and 79. And we started looking at their health records from 2005. And what we found was that over the subsequent next 7 years, those people who were living in residential postcodes with the highest level of pollution in Greater London, they had a 40% increased risk of developing dementia over those next 7 years compared to people who lived in the lowest 20% of pollution in Greater London. So that was very strong population-based evidence to say that there seems to be something about the quality of the air that you're breathing and your increased risk of developing this condition. The next study, which I want to tell you about, isn't an old age. It's actually just in the youth. And this study was conducted with colleagues at the Institute of Psychiatry. And what we did was we measured the children's air pollution exposure at the age of 12, and then these children were followed through to the age of 18. And what we found again was that those children who were exposed at their home postcode to the higher levels of pollution in London, they had a much greater chance of expressing teenage depression with the just linked to their pollution exposure. And this study was published a few years ago. I think it was back in 2019. And since then, 7 other studies in different countries have come to the same conclusion. So it's not just a lifetime of poor air quality exposure leading to changes in the brain. We think that these changes are beginning quite early in life, and subsequently they can have a whole range of effects on our mental cognition. And then my final slide, I just want to say that the evidence is very strong now for these links. And of course, we've been hearing more and more about the importance of mental health. certainly during the pandemic, it was certainly something which was really came to fore. But from what I've been telling you today, the issues are with us every day in cities like London, because the quality of the air that we're breathing is having this impact, this ongoing impact in many different ways, not just on our lungs, not just on our heart, but also on our brain. So it's affecting our heart and soul. Thank you very much, Karen. I'll finish there.
Thank you, Frank. Very powerful and compelling evidence. Thank you for those slides. Now we'll move on to our second speaker, Dr. Susan Mitchell, who's the head of policy from Alzheimer's Research UK and has been leading several projects on improving the earlier diagnosis of the diseases that contribute to dementia, and previously head of health policy at the Royal College of Paediatrics and Child Health. So looking at some of the latest research on links between air pollution and dementia. Over to you, Susan.
Thanks very much, Karen. And I'm really glad to be here and talking about this. I'm going to talk to you a little bit about what we're doing as a charity, about, Frank's obviously given some of the context about why air pollution, its relationship with dementia is so important. So I'll talk a bit about that and also some of the research we're announcing today that we're funding. So if I could have my next slide, please. So Frank did touch on some of these points, but, I think it's important to recognise that there are almost 1 million people living with dementia in the UK currently. Oh, sorry, could we go back one slide, please? Thanks. Dementia is the leading cause of death in the UK, and currently there are no treatments available to change disease progression. So that means actually everything we can do to try and prevent dementia is absolutely crucial. Now, as Frank already said, this is an area of emerging research and we've got a growing evidence base. And in the past couple of years, really, air pollution has been recognised as one of 12 possible risk factors for dementia. Obviously, things like age and genetics do increase your risk of developing dementia, neither of which you can really change. But there are these other modifiable risk factors. They also include aspects around heart health, around education, around hearing loss and other factors. But air pollution is one of them. And actually, these 12 risk factors together could potentially avoid up to 40% of dementia cases if all your risk factors were fully mitigated. I think the other thing that's really important is there's actually really quite poor understanding around this potential. From polling we've done with members of the public, only about a third of them actually think they can change the dementia risk. So some of this is also about awareness raising, because if we want to make the case for some of the policy change we might need for something like air pollution and improving air quality, we do need to make sure people understand the impact it can have on a range of health conditions. So if I could go to the next slide, please. So what do we know? Obviously, it's very much emerging research. As Frank said, this is an area where we've really started to focus on research in the past few years. And as Frank talked about, we've got this kind of population relationships, but we do really need to better understand the mechanisms that are taking place. What's happening, which means that air pollution is actually influencing dementia risk and processes in our brain. There are possible ideas about what this could be. And again, we definitely need to understand these better. It could be that air pollution affects blood vessels, and that those blood vessels obviously then also feed into your brain. And therefore, that it's a kind of cardiovascular mechanism. There are also ideas, and this is not even published, but very much kind of a starting theory, that the pollutants that you see are able to actually change how your brain removes toxic proteins. Things like Alzheimer's disease, the leading disease that causes dementia, is associated with the buildup of certain toxic proteins which damage your brain cells. So it's possible that pollutants sort of change how your brain removes these or manages these toxic proteins. Again, we don't really know at this stage, and it's these kind of things we need to understand better. If I could have the next slide, please. So what are we doing? So today we're announcing a project we're co-funding, which is looking at what happens in your olfactory bulb. Now, your olfactory bulb, I mean, in the picture on the right, it does look a bit like a toothbrush to me, is a bundle of nerve cells that are kind of the interface almost between, where you breathe in and then links into your brain. And so we've got a fellowship with Dr. Jake Brooks at University of Warwickshire, who's going to be spending what is the next 5 years looking at the relationship of metal-containing pollution particles as they enter your brain through your nose, how they might move into your brain through the olfactory bulb, and what that might mean in terms of, as I said, changes to certain toxic proteins such as tau. It's an early stage, but I think it's this kind of work which is so pivotal to actually understand the mechanisms. Understanding dementia risk is hugely complicated. It happens at the end of life, and there have been many exposure factors. And these quite focused areas of research are really crucial, particularly if we're going to come back to the point that Karen made at the start, that we need really strong, robust evidence. And it's work like this which does that. So we're really delighted to say this evidence is kicking off, research is kicking off today. It is obviously the start of the process, and there'll be much more to learn. And really delighted to be able to talk about that with you today. I think that's everything from me. Oh no, sorry, I have more to say, apologies. Yeah, I think, as I said, this is the start. It's the start of research. We do need more, both in terms of the specific mechanisms for dementia, but obviously, air pollution affects many other health conditions, and they often come in tandem: mental health and dementia, cardiovascular, stroke, they come together. So we do need to understand the interface between different health conditions. And obviously, having better evidence, we can build the case for improving air quality. And, we'll be working in collaboration with partners to try and seek as ambitious air quality standards in the UK as we can, using the evidence base we've got. That is definitely it from me now. Thank you.
Thank you very much. Maybe we can pick up in the discussion. I think this incredibly important point you touched on there about developing a positive argument and not just the warning arguments about how there is a possibility for change if we get the policies right. And some of that is behavioural, but most of it is about removing the structural barriers, of course. Okay, so moving on to our third speaker, Larissa Lockwood, who's the Director of Clean Air at Global Action Plan. Larissa is an air pollution and behaviour change expert with 20 years experience in the sustainability sector, leads Global Action Plan's clean air portfolio, including the work on Clean Air Day and the Clean Air Hub, and helped establish the Sustainable Development Unit and Carbon Reduction Strategy for the NHS. And Larissa is going to discuss future collaboration for policymakers between involving air pollution and mental health and dementia organisations. So over to you, Larissa.
Thank you, Karen. Gosh, yes, just to take a moment to sort of reflect. It's quite shocking, isn't it? Because we've been talking about these physical health impacts of air pollution for years, but to understand the impact it's having on our brains and mental health too, it really is startling. I like the way you put it, Frank. It's affecting our body and soul. And some key points that I took away from this is this increasing prevalence of dementia in old age. Those rates are going up so quickly, but also the really sad fact, the impact on younger people and the developing brain. And I'm sure this is really, well, it's quite personal, isn't it, for many of us? I'm sure many of us know someone or have a mental health condition or know someone with dementia. I have a mother with Parkinson's, and, it's just horrible to think that the air that we breathe, that she breathes, might be contributing towards this, and that we're doing this to ourselves knowingly. That's what always gets me. This is a human-made problem. We are doing this to ourselves. It is quite disturbing, which really what we've heard today, I think, further makes the case for why we need urgent local, national and international action on air pollution. It does feel like air pollution is quite prominent at the moment, not just because Clean Air Day is trending on Twitter, but if you think about, the wildfires and orange skies across North America that Karen mentioned has been in the news, and the high air pollution that we're seeing across parts of the UK this week, in part due to this recent heat wave, all of which is being made worse by climate change. Again, something we're doing to ourselves. And climate change and air pollution really are, they're kind of the double whammy here. They're two sides of the same coin. But luckily, the solutions are also therefore the same, or many of them. And frankly, we have to stop burning fossil fuels as soon as possible. And as an organisation at Global Action Plan, we're very keen to see this happen in urban areas by 2030. And we really need to do this by 2030. That's the timeline we have to work to. And we're a charity, small charity, but we are doing our best towards this by mobilising organisations and individuals to call for action and act on the systems that harm us and our planet. And it is this mobilisation that we're seeing today, and that is what gives me hope and positivity. Today is Clean Air Day. It is the biggest day of the year at Global Action Plan's campaign headquarters. If you look at the Twitter feed, it's full of wonderful images and messages from people up and down the country showing their support for clean air and doing things for clean air. This is something that people really want. We've got schools in Barnsley, Birmingham, Barnet, all doing air pollution lessons and poster competitions. workplaces doing walk, cycle and wheel to work days. I think I spotted a picture of the Mayor of Worcester commuting on a bike in his full garb and chains. And there are street parties, carnivals with bubbles, musicians and artists, companies offering free scooter and bike hire, electric buses being promoted, discounted bus tickets in Cardiff. I think Alderhay Hospital in Liverpool is hosting a hospital street, so like a school street, but for patients and visitors to sort of benefit from reduced pollution around the site. And then there's a whole range of other sort of webinars and conferences going on, including the first annual Black Child Clean Air Conference at the Royal College of Obstetrics and Gynecology in London. And they've also put out a report today, which is a really important conversation to be having. So, you know, to give yourself some hope, you know, and to develop this positive argument, you know, just have a look at #CleanAirDay to really see the wonderful things individuals and organisations are doing today to help everyone to breathe cleaner air. And at this point, I think I should say a massive thank you to all the wonderful supporter organisations and participants and everyone who's taking part in the campaign today. It's only big and brilliant because everyone gets involved, so thank you. Also a big up to our delivery partner in Scotland, Environmental Protection Scotland, who are making Clean Air Day Scotland amazing. And of course, I need to thank our Clean Air Day partners who make the whole campaign possible. We literally couldn't do it without them. So that's the Scottish Government, the Welsh Government, Chiesi, Mitsubishi Electric and EVs and Opinion. So thank you very much to all of you. But what I think all this activity today really demonstrates to me is this public demand for action on air pollution. We know from our quarterly polling, because we've been tracking public attitudes and behaviours since 2018, we do that every quarter. And we know from our polling that the majority of the UK public really do want clean air. But today it feels visible, it feels tangible, you know, you can really see this call to action coming through from people. And we don't just want people to be sort of putting it out publicly, but also channeling these messages to local councillors, because I think our local and national decision makers need to know that we want clean air. We need to tell them that we want clean air and specifically what we want as well. We need to show our support for clean air measures to improve air quality. We know that there is this majority who support clean air measures, want cleaner air, be that a local park and ride scheme or a segregated cycle path, or indeed the expansion of the clean air zone in London. Because, yeah, polling shows people support these measures, and that gives me hope. For example, we know that 68% of people want to see increased investment in public transport. Over half want to see increased investment in walking and cycling, and over half of UK people want traffic minimisation measures that will decrease the number of cars on the road and allow people to walk, cycle, wheel, etc. more safely on their neighbourhood streets. So, you know, the evidence is there, and hopefully that message today will get through to our decision makers. Because I think making decisions and taking action to tackle air pollution is where we must now focus. It's really wonderful to have new organisations getting involved in this call to action. You know, we've got this growing evidence base, all this mental health and brain health work going on, and brilliant that the mental health organisations and brain health groups are getting involved, many of whom are represented here today, which is why it's sort of so powerful, I think, to have Alzheimer's Research's new project, but your calls to action as well, to really sort of broaden the church of organisations calling for clean air. And anyone who is on this meeting and isn't an official supporter of the Clean Air Day campaign, please do drop me a line. We can get your logo up on the website, along with over 300 other supporter organisations from health, charity, education, local authority and community sectors. You are not alone. We are not alone. This is a majority call for action. And I think it's also quite nice being part of that group, because it is this coming together around a moment on Clean Air Day that really gives it its power. Of course, I want to see clean air every day and a sustained public engagement campaign, yes, but in lieu of that, you know, we have Clean Air Day and this focal point of the campaign. You know, we need more and more organisations looking at air pollution and calling for action, and seeing sort of mental and brain health organisations joining this year really does give me hope. I'm going to finish shortly. So what do we know? We know that air pollution is a problem, and we also know that people are concerned. I think we have enough evidence to act now, but what we also know is, as the Chief Medical Officer, Chris Whitty, puts it rather well, that air pollution is solvable. So let's solve it. You know, we know that people want change, so let's create that change, but it will take all of us to do that. We must aim for World Health Organization limits for air pollution. Why wouldn't we? And to get there, we need not just cleaner vehicles on the road, but fewer vehicles on the road. We will need to decarbonise home heating and cooking. We must move away from gas and log burners. And we also need to focus action in the places where the most vulnerable spend their time. So schools and health facilities, those must be clean air places. And we have to do this in a way that is equitable and that will reduce health inequalities. So there are heaps of resources and tools to help with that transition on the Action for Clean Air website. But today, if there is one thing you do for Clean Air Day, I would ask you, please, to write to your local councillors, tell them that you want clean air and ask them to do more to tackle air pollution. They need to hear from you. And again, there is a template and a tool on the Clean Air Hub. So please join the many doing this and send that signal today to our decision makers that we all want clean air. I'll leave it there. Thank you. I think you're on mute, Karen.
Oh, yeah, sorry, I'm muted. I'd forgotten those days. I sort of not got used to not having to mute and unmute. So I think there's a couple of questions in the chat. And Laura, are you going to help field any other questions or brief comments from the floor to the panel? But I think if I can just see the one that struck me as quite interesting, which is from dear Linda, on the issue of indoor air pollution. We tend to focus on the issues of external pollution and vehicle pollution and so forth, for understandable reasons, but there is an issue about indoor pollution, and that possibly is an interesting crossover into the areas where individuals, businesses, schools, small organisations can help to facilitate change and not be in the position of looking to government and local government to bring about change for them. And I think there are always an interesting balance to be struck there between how we can encourage people to make changes and learn from that, and about the lobbying for governments and the institutions that can make the big structural changes. I don't know, dear Linda, do you want to just put that question and see if the panel have got any responses to it?
I'm not sure if webinar attendees can actually unmute.
Oh,
Karen.
right, okay, they might not be able to. Well, shall I read it out then? Dr. Mitchell mentioned that age and genetics also impact the likelihood of developing dementia. Could it be that the age aspect is due to the lifelong buildup of air pollution particles and damage? The longer people live and older people have increasingly sedentary lives, indoor polluted air also escalating this problem. And there's further question, could it be the genetics aspect is due to families living and growing together in the same indoor and outdoor local polluted air? So the problem is sometimes these are families in different staggered points in time. So quite an interesting cluster of questions there. I don't know whether anybody, Frank or anyone, has got a thought on that issue.
Karen, I'm very happy to start on that one.
Please.
I mean, there's been up to date, there's been very little attention on indoor air, and that's because we really haven't had the measurements. So we measure outdoor air pollution, and that's allowed us to do all the work that we all know about. To measure indoor air pollution, clearly, you know, you've got to go inside someone's home, inside their castle, and that was always, you know, a bigger challenge. And secondly, you know, the equipment previously was far too big to take into a home. Now we can do that, and now that work is starting, and increasingly, you know, we're worrying about the potential impact of indoor air pollutants. The pandemic really brought this to the fore when we started thinking about the need for better ventilation, etc. But it's a complicated issue because you get outdoor pollution coming indoors. You've got the indoor sources as well. So whereas Larissa was saying, you know, how much more evidence do we need? to get some action on this issue. Outdoors, there is no more research required. It's very, very solid. Indoors, I think we've got to do a bit more before we can come to that conclusion as well. And the final thing I would say is that other countries are already doing things in this area. Belgium has brought in a new law which is controlling indoor air pollution levels in all their public buildings. The USA has just upgraded their ventilation and indoor standards as well. So I think it will be coming.
Thank you for that. Either other speakers have anything to add?
I completely agree with what Frank said. I think this point about kind of lifetime risk is a really interesting one. And again, this understanding what this looks like and, exposure, and how is a lifetime of exposure different to perhaps a really concentrated period? I guess the reality, we know that there are younger people who are being affected by air pollution immediately. Quite what that then transposes to in terms of what that does to their dementia risk and their brain health, we don't know. I think it's a really interesting question that I don't think we can quite pin down yet. So one to answer in the future.
Okay.
And if
This has been picked up by a couple of other people. Mick Holder, I don't know if you're there or want to say anything, but you raised the interesting point about occupational health addressing this issue, and so we kind of see a lot of this through the prism, and rightly, of what governments, local and national, should be doing, but bringing in other players into the field and giving them responsibility is an interesting angle. Has anyone on the panel got a thought about the occupational health responsibilities?
Well, again, I mean, clearly we have got occupational standards in a lot of situations. The general feeling, I think, is that they're pretty antiquated and many are out of date. And there are certain professions, especially outdoor workers and some factory-based industries, where people really are exposed to high levels of pollution. Vehicle drivers, taxi drivers, lorry drivers, bus drivers, they're also a big group of individuals who are being exposed to pollution. But I think we generally need to tighten up our occupational standards because they seem to be somewhat last century to me.
Okay. Any other comments?
Again, I agree with Frank, and I think this point, we can think back to the kind of impact that part of the smoking changes in smoking have been about recognising the occupational impact of smoking in workplaces, and I think again it's that joining these things up is so important. And I think we don't think about air pollution within the occupational health point, but we should, and every opportunity to kind of find the myriad of different impacts it has is crucial. So I think it's a really good approach which might have impact in a way that other aspects haven't.
Mm-hmm. And I suppose this all, you can pull back into this kind of bigger question about who the public think has the responsibility for this, and who are the agents of change, with a risk that it's seen as only the government, and the government should be at the heart of this and has the core responsibility, but it's, I think, kind of very important that it's not only the government. So I mean, do we know from research what the public think about this in terms of where the responsibility lies? Does it all lie upon central government to set the frame, or do they genuinely believe other agencies have responsibilities, and if so, what?
I can come in on this one as part of our sort of polling. We haven't asked that question for a while, but the last time we did, there was a strong feeling that it was the central government's responsibility that came out first, but secondly was the business responsibility and the business community. So I think people sort of recognise the role of industry there, but also in terms of occupational health, but also I think the vehicles that many businesses have on the roads as well. So there was a strong feeling, central government, businesses, and then local government further down, but very strong feeling that the onus of responsibility should not be put on the individual. So I think at the moment a lot of people saying we would do more, but we can't do more because it's unaffordable to switch to an electric vehicle. I don't have the infrastructure on my street to be able to sort of own a bike and lock it up. It's not safe to walk my children to school because the pavements and the cycle paths are not there. So I think there's a lot that we need to do to change the way our communities are sort of built and put in that infrastructure so that people can make those cleaner air choices. And that has to be done by the decision makers and by businesses. So to enable individuals to play their part too.
I think when we move indoors, I think it changes somewhat because clearly there's a lot of behaviours which we have indoors relating to the sources there. Certainly in privately owned homes, that would be the case. We can make a lot of choice as to what we're contributing in respect of, you know, air quality benefits. If we're talking about the rental sector, then I think it's, you know, it's the organisations that own those properties and rent them out, be it councils or private organisations, because things like, you know, gas cooking, gas boilers for heating in homes, I think in due course, you know, they will have to be removed from the system. We're talking about doing it from a climate change point of view, but there will be enormous benefits from an indoor air quality point of view if we can manage to replace them as well. So I think when we move indoors, then I think, you know, government has got, you know, a balance, there's a more balanced requirement in respect of responsibility.
Mick Holder's back in the chat making I think a kind of very interesting and valid point that the risk associated with government being the main agent of change, and I mean there's no that's unavoidable, and I'm not suggesting it should be avoided, but that it always risks playing into this narrative, which unfortunately is a narrative that's built up in recent years, fueled by social media and to a certain extent supercharged by COVID, that that government is using statistics to restrain people, constrain people, limit their choices. Mick says it's, you know, the anti-fun police, and you know, that's clearly an important strand in the public view. To what extent are people in the campaigning world around air quality thinking about how we can win some of that argument back? Because what we also know in all of this is that myth busting does not work. You know, it's incredibly powerful that you have a high degree of medical consensus and you have clinicians out there in large numbers supporting initiatives and making the science around health as close to unarguable as it can be. But in terms of the policy changes that need to be made to implement it, you know, I think we've got to kind of recognise that there is a strand of public view here that is very anxious about all of this, and how do we take them with us?
I think if we're talking about traffic reduction measures have been being put in place for sort of decades now, and those who have experienced this over the years, I think, do sort of benefit, will say that they benefit from not just the reduced number of vehicles going by, but also the sort of enhanced sense of community and road safety and just ability to sort of use the street space in a different way. You know, children can play football in the street, or, you know, it's easier to talk to neighbours over the road. It sort of makes it a nicer place to live. But of course, some of these measures have been pushed through quickly. Some haven't been done with adequate local consultation. I think there are some places where you know, but greater community consultation and involvement is definitely required. But over the decades, I think you know, they have been successful, and there are all these positive co-benefits, like you said at the beginning, Karen. You know, we need to develop this positive argument, and I think it is, you know, a clean air future isn't something where you're just having things taken away from you. This is about you know, breathing better air, enhanced health, safer streets, more active travel, quieter streets, more building communities. Like, there is a very positive vision that we can tap into here.
I also think that there's still a large sector of the population who don't understand the issue. It hasn't been explained to them properly. And I think, Larissa talked about, having an awareness campaign. We really need something like that, because until we have that level of understanding, and we have, for example, when you go along to see your doctor because you've got a respiratory problem, the doctor will probably never mention, where do you live, what's the air quality like, etc. Until we have it as part of everyday life, that we think about air quality, then I think there always will be people who question measures to improve it.
Thank you for that. Some questions are rattling in, which I think are all very interesting. We've got a question, I have to go back and find it, but about the variation in monitoring in different parts of the country to give people information. I mean, what is this then? What's the answer to that? Is that really coming back to local councils? Is that coming back to the work that's being done with local directors of public health, which is another question about how we get them engaged, and whether they are engaged consistently across the piece. Anyone have a view on that? Monitoring and public health.
Well, I'll just start and say that you'll never be able to do enough monitoring, because that would require monitors everywhere, in every street, every home. There are some areas which are better blessed with monitoring than others, and that is down to the spend the local councils put in. There is a minimum requirement, but many councils understand that they need to do more than that. And then I think the issue really is how well that monitoring that we have, how is it being communicated to the public? Often people don't know where to get the information. They don't understand the information. So there's issues right through the whole monitoring question.
But I do think people do need that data. It is part of the public engagement, isn't it? So there is a sort of common perception across the UK that air pollution is only bad in London, and even amongst some Londoners that it's only bad in central London. And that is not the case. We know that vast swathes of the UK are not reaching World Health Organization levels of air pollution. The majority of us are breathing air that is considered unhealthy, and we really need to sort of help people to understand that air pollution is a real and personally relevant issue for them, not just asthmatics in London.
Okay, let's a couple of other questions, rattle through a few of these. Martin McGee says, shouldn't government remove approval for wood burning stoves and require for that to follow in new development approvals?
And I think Martin also asked a question about talking about domestic burning as well. Can we do a wintertime Clean Air Day campaign? And I'm very pleased to tell you that we will be doing that. We're looking to develop a Clean Air Night campaign to run in winter. It's quite hard to talk about domestic burning in summer, especially on really hot days like this. It's just not front of mind. But every year we do get people saying we need to talk about domestic burning. And you're absolutely right. We do. It is the largest source of PM 2.5 pollution in the UK, so we will be exploring that in much more depth over the winter period, and would love people to get involved in that. So please, Martin and others, do get in touch, because yes, we need to do something to reverse the trend in solid fuel burning, which is contributing the most to PM 2.5 pollution in the UK at the moment, and its trend that's going up.
Yep. Jonathan Gartside asks, what in your view could be the role of more localised air quality monitoring to build a comprehensive integrated database between patient health and air quality? If it's valuable, what actions need to be taken to make this capability a reality?
So we have an excellent example of that in London. It's a sensor-based programme, which means it's run with cheaper equipment. It's called Breathe London. We had got funding to underpin this, where we were able to ask community groups if they're interested in air quality in their local area to apply to us to to get one of these sensors. We would help them, identify where it would be best placed. And basically then they owned the information. We helped them interpret it, but then they used that to discuss the issues in the local area. And I think taking that approach, as opposed to just a central government or a council approach where they measure the air quality and hope people looks at the data, I think it's a much more, I think it's the way forward, in the way we need to go.
Anyone else?
Frank's your man on measurement. Him and his team, you can't beat the Breathe London network. But what we would like to see is that across the country, the quality of data is very patchy, and it's good in London, not so good elsewhere.
John Muir asks, regarding indoor space, does the panel have any thoughts on active resources and active measures to remove pollution such as filtration?
I mean, this is going to become more and more of an issue as we increasingly tighten up our home airspace, from a climate change, from an energy use point of view. There is a chance that we'll be trapping lots more pollutants in our homes, which won't be able to escape because ventilation will have reduced. So we're going to have to come up, in the modern building standards, we're going to have to come up with approaches to deal with that issue. I guess in our existing homes, it would be really, if people understand what they're doing from a behavioral point of view that's leading to an indoor air quality problem, then at least they have the ability to make decisions, behavioral change decisions, which could improve that situation. If they don't have the information, or if they don't, if they're not willing to change the certain behaviors, such as if they've got wood burning stoves, etc., then yes, filtration to clean up the air could be, a way forward. But it's expensive and it uses energy. So, it's not the place that we all need to go to begin with.
Thank you very much. Lynn Williams asks again about the public health directors and how we engage them, and what are the next steps to getting public health directors on the all on the same page on this?
I'd say it's not just public health directors, but sort of all health professionals, really. I'm not sure that air pollution, well, I know that it's not on the standard medical curriculum. This isn't something that health professionals really know is a significant health problem, or they do their own research to find out, but don't feel sort of confident enough to have those conversations with patients. And I think health professionals provide an absolutely essential role in terms of being a trusted messenger. And you would expect that if you have a conditions that's linked to air pollution, that your doctor might sort of mention it to you. That's somewhere where you would expect to be hearing that information and to be given some advice about what can be done about it. So it's something that at Global Action Plan we've been doing a lot of work on, doing pilots with general practice, with respiratory and child health professionals, and do have a suite of training materials and resources that are now being sort of promoted by the Royal Medical Colleges. But this needs to become just part of standard training. It needs to become central and core, so that all health professionals feel able and confident to advise patients about air pollution. And just while we're talking about health sector, if I might, there's also a couple of comments around whether we need to have clean air zones around sort of hospitals, healthcare facilities and care homes, given that some of the most vulnerable are spending significant amounts of time there. And it's kind of ridiculous to go to these places to go and get better and actually be exposed to higher levels of air pollution if, for example, they're by busy roads. I'd be really up for exploring this. What would it look like to have sort of clean air zones around places where the most vulnerable spend time, around schools? I mean, it essentially sort of school streets are the start to do that. And we see Liverpool Alderhay Hospital is doing a hospital street this clean air day, again, trying to take that immediate source of traffic pollution away from the doors of the hospital or of the school. So it would be really interesting to look at what it would take to sort of have clean air zones around these buildings. And I've always wondered, and I don't know if anyone can look into this, but around sort of sat navs and their navigation, whether there's anything that can be done to sort of divert people away, routing away from those who are most affected by air pollution. I know it'll be complicated, but I think we do need to look at these places and ensure that healthcare facilities, care homes and schools are sort of clean air places, and that will involve reducing the traffic pollution around them.
I just jump in, I just built on Larissa's point about the role of health professionals, and I think anyone that has that kind of communication opportunity, and I think there was a question in the Q&A about, you know, do clinicians even know about the link between air pollution and dementia? And I think I'd say almost none do. We know from some research that's gone on that clinicians struggle to talk about dementia risk factors generally, even, you know, perhaps the strongest ones around kind of cardiovascular health. So I think there's a lot to do there, and I think obviously the resources that Global Action Plan are developing are great, but I think it's about also the widest group of people. You know, as Larissa said, it's a wider conversation, and that is so crucial and so important, that it is a broader than just, you know, if people are only hearing about kind of clean air because of either deaths or because, you know, there's a congestion charge and what that might mean for them. There's a really poor opportunities when we could be communicating and finding different ways to engage on such an important topic.
Thanks very much. Interesting point, Sarah Deakins. I just completed my master's in public health, and we did very little on clean air. Now, you know, I found that's disappointing, isn't it? Clean air, air pollution, it's been around forever as a source of concern for some, but I think become a much more mainstream issue in the last decade or so. But the fact that, you know, that's not necessarily reflected in what people learn in areas of public health, you know, is quite concerning. So look, as we kind of start thinking about winding up, one of the questions in there, which I think is a very important question, and it draws together quite a few of the points in the discussion. How do you make the positive case? And that's a tough one, because the positive case rests on an understanding of risk. I mean, people need to know that air pollution is bad for them in a number of different ways, and the contributions we've had from the panel today focusing very much on areas that people probably wouldn't have expected. They tend to think of it as being a respiratory, primarily an issue of respiratory health, but actually brain health, mental health and potentially dementia are key factors. So people need to understand the science of that. They need to understand the risk. That is not necessarily a terribly positive message. The positivity lies in the fact that things can be done about it. The governments can do things about it, but also other people can do things about it, including at a local level. For politicians, the challenge is always that what we do about it either tends to involve restrictions or spending money, both of which are potentially problematic in different ways and aren't always popular. Both of which can win support if the argument's right, but it's it's a partnership approach in all of this. Politicians can't lead too much if the public aren't convinced. But we can help spread that message. In my own area, we've got a very good community organisation, Clean Air Bayswater, in one area, where parents and residents have come together and organised, done monitoring, led a campaign, pressed the council for action. A number of other neighbourhoods don't do that, and they tend to be the poorer neighbourhoods. What can we do as politicians? What can you as experts help us do? Is there a toolkit that we can use to promote that work in neighbourhoods, in schools, giving them tasks that make it easier for politicians to lead that debate?
I think Larissa's going to come in here, but just before you do, Larissa, because there is lots and lots of stuff, what I would say is I think there is a need to educate, because once the public understand this, then they will demand action of government. At the moment, they don't understand it, and that's why they're not demanding action. And then when they do demand action, yes, there's a whole raft of things that Larissa's just about to tell you about that can be done.
Yeah, good point. Gary Fuller makes the point that it can save money too, and that argument needs to be part of the mix.
Yeah, and it's kind of the approach we take to Clean Air Day. It's presenting the health harms, because people need to know that this is a problem. Otherwise, they're not going to do anything about it, nor are they going to support policy and wider systems change for it. But you've also got to give people that hope and that opportunity. And that is painting the positive vision of what a clean air future and community can look like, which is nicer in so many ways. But also, I think, for the policy community and politicians to understand all the positive co-benefits in terms of not just the direct health impacts from air pollution, but the co-benefits from the active travel, from the enhanced community cohesion, the enhanced educational opportunities. There's links through to crime. This is all about sort of preventative state type benefits and co-benefits. There's a very strong case for action. And of course, on meeting net zero, this is not just a pure environment or health issue. This is environment, health, education, social outcomes. There's a very strong opportunity here. And then the third element, which is what we want everyone to do today on Clean Air Day, is action, and everybody has to do something. And I'm very happy to meet with you, Karen, just to go through all the things that people can do. But in terms of some very quick and easy tools to use, we have resources for integrated care systems, for schools, frameworks that can help those organisations in local areas to get stuck in and do what they can on air pollution. But there is only so far that these organisations can go. We do need the systemic change, which will involve investment. We need investment in active travel. We need investment in public transport. We need investment in improving the energy efficiency of our homes, so that we need less fuel in them, to help people transition away from gas in the home. There's a whole suite of measures that will require investment, but that will create jobs, and that will be better for the UK economy. I'll rest there. But if there's one thing,
well, we are winding up. Any
last
last short lines from Susan or Frank?
I think Larissa put it beautifully. I think education is the start, and it makes the case, and that's the positive. And there are so many good things we can all do. I can't beat what Larissa said.
Frank, you went first. Last word.
Well done, everyone. Thanks for joining us today.
Yep.
Let's all do something about. Let's have an action.
Absolutely, absolutely. Well, thanks to a superb panel. Thanks to everybody who's joining us, and we'll keep this moving in Parliament and elsewhere. Thank you.
Thank you very much, Karen.